again, everybody. Steve Wilder, president of Sorensen, Wilder and Associates, with you. Welcome to another safety and security podcast. And I'm really excited today to have a gentleman with us he started out as a client years ago, and over the years has become just an incredible friend, a colleague, a trusted advisor, still a client, and we're very thankful for that. And it's really exciting today to welcome Tom Rhoades from Parkview Health in Fort Wayne, Indiana, to join us. Tom is the Chief of Police and the Corporate Director of Public Safety and Emergency Management for Parkview Health, which is a very large healthcare system that covers much of the northern and eastern part of Indiana. Tom's done some unique things with the program. I'm going to let him talk about them and explain what they've done with their hospital safety and security program and how they've transitioned it into a true public safety program. So, Tom, welcome. It's great to talk to you again. Thanks so much for joining us today.
Well, Steve, thanks for the invitation, and it's always good to have an excuse to chat with you.
Thank you, friend. And as I said, you've been a friend for years, and I really appreciate your taking your time out of a busy day to join us for a few minutes. So you've done some incredible things there. I remember when we first met, your program, much like hospital security programs across the nation, was made up of a good group of professional security officers. And we were impressed the first time we saw it, and you've just taken that foundation and built on it. Talk a little bit about what you've done in terms of developing a hospital policing program, Tom.
Sure, and I appreciate that question, Steve. Just for a little background, I had spent my career in law enforcement. Had worked on the Fort Wayne Police Department, risen to the rank of captain, and served in various roles across the department. And had an opportunity to join Parkview Health as their security director now 14 years ago, which is really hard to believe. And really, I joke with people saying, I came into this position at Parkview thinking, what a great retirement job. And then I laugh. It is a great job, but it is the furthest thing from a retirement job. And not that I was looking for one. I was shocked at the risks that existed within a healthcare environment. It was something I knew nothing about, really coming from a municipal agency. And so took some time to really get acclimated to the hospital environment, did a lot of reading about campus security in healthcare. And I think one of the things that really hit me kind of between the eyes to begin with was the fact that 75% of all workplace violence incidents in this country occur in a healthcare environment. And on top of that, we still believe that probably the majority of them still go unreported within our industry. So that was a startling statistic to me. We've had a number, and still do, unfortunately, a number of hospital shootings that have occurred around this country. And so that was the first, I think, reality check for me that this is a different environment that really needs a very focused effort on improving security in our workplace.
How did the idea for hospital policing originate, Tom? And what were you trying to achieve in developing this program?
Well, I'll tell you, as I looked at the workplace violence, I got to know our organization better, which again is no different than a lot of other health systems when it comes to risks inside. I started to recognize the risk that drug seekers posed in our ERs and our pain management clinics. I looked at the risk that those felonious traumas, those gunshot victims and stabbing victims and assault victims that occur in our communities and then come into our doors for care. I started to realize the risk that they present to our medical staff and our coworkers. In fact, in September 2012, we actually had an ambulance en route to our facility that was shot up about 18 times by a carload of individuals here in town. They could have continued on to the hospital and really posed even greater risk there. I started looking at our family birthing centers, something that I always thought was just a wonderful, happy place. But you're bringing together family members that haven't always gotten along together, or the father of the patient doesn't like her boyfriend or husband, or the father of the child. And so, again, another volatile area within our hospital. And it caused me to really start asking myself, is unarmed security really adequate to guarantee the safety of our coworkers, our patients, and our visitors? And then another thing that I was passionate about as a police officer was domestic violence. And I started to look at the number of female coworkers we have in healthcare. And probably 75 to 80% of our coworkers are female. And so we know that on any given day within Parkview Health, we probably have about 2,500 coworkers who are in or have been in abusive relationships. And those of us in security know that the number one cause of death for women at work is often homicide as it relates to domestic violence. So a lot of questions started coming up in my mind, asking if the level of security we had was really adequate to do the job we needed them to do.
And so many of our listeners have been through our active shooter program for healthcare facilities, and they've heard myself or Dan or whomever might have been out there doing the training talk about that, because it's the risk of domestic violence to me that was probably the number one threat that we face for an armed intruder in the hospitals as well. So I'm again a big cheerleader of what you've done there. Now, knowing Indiana as well as I do, you guys were the first hospital in Indiana to develop this hospital policing model.
That's correct.
I guess what I was thinking, it wasn't just something where you could decide to do it, sell your administrators on the idea and go out and hire people and get them some training. You had to start with legislation. Is that correct?
That's correct. When I arrived at Parkview, we were in the process of beginning the build of a large regional medical center. So as I started learning these risks that existed and started asking these questions, and we're building our new medical center, it took a couple years before we were finally in a position to where I could start following up on this question about the adequate level of security. And I remember having conversations with our CEO, and he asked me, do you want to arm security officers? And I said, I really don't want to do that. Again, our security staff did a phenomenal job, but they don't go through the hiring, the training, the vetting that police officers do. And he then asked, do you want to hire off-duty police officers from our municipal agencies around our facilities? And I really didn't want to do that either, although, again, they do a fantastic job. They don't understand the healthcare environment, just like I didn't understand healthcare before coming into to my current job. So he asked me, "Well, what do you want to do?" And I said, I want to work with an area legislator to get a law passed in Indiana that will give hospitals the right to create their own private police department within Indiana. And that conversation, I had that with Senator Dennis Cruz, who was a senator in the region. He was excited to do what he could to make hospitals safer across Indiana. And so in January 2013, he introduced a piece of legislation that he and I had worked on for a couple months prior, tweaked it, and got it to where we thought it was a good piece of legislation. And it started moving through our Senate and then through our House here in Indiana.
And it passed the first time through, if I remember correctly.
It did, not without some changes, some amendments. Again, some things that maybe I would have preferred to have had the other way, but my philosophy was the changes that were made weren't worth losing the bill over. Very rarely is legislation perfect when it comes um, through our House and Senate processes. And we've had a couple opportunities where we've gone back and tweaked it here and there to make it a little bit better, and still some things we want to do. But it did pass the very first time, and so July 1st, 2013, Indiana hospitals for the first time ever had the right to create their own police departments.
And that is so incredible. And Tom, refresh my memory now. Parkview Health, consists of how many hospitals?
I believe we are at 12 hospitals currently.
Okay, so 12 hospitals, and all of the hospitals, if I'm correct, have been staffed by both hospital police officers as well as hospital security officers. Is that correct?
That's correct.
Okay. I- in terms of the employee response, how did the employees feel about this? I mean, you're suddenly introducing, albeit qualified professionals, and we'll talk about training in just a minute, but you're bringing these qualified professionals in now as hospital police officers. What was the response of the staff? How did they feel about having that police officer presence as opposed to the security officers that they were used to for all those years?
A lot of our staff were extremely supportive from the very beginning. I, I would even go to say all of the staff. We've had overwhelming support from our caregivers, our providers, and from our support staff. I think the biggest message that Parkview was able to deliver to our coworkers was that we care about your safety and your security. And if you picture yourself, if you're that bedside nurse and you've been assaulted, or you're the person who has a violent domestic situation at home, and we can walk you to your cars and we can provide you security at work. It's been a real strong message of support to those coworkers across the health system. So they've been extremely excited about it. And we just recently went through our magnet recertification. And of course, magnet is really focused on the safety and security of the bedside caregivers and the nurses.
Right.
To hear those nurse leaders just go on and on and on about our police and our public safety team was just so refreshing. It really reminds us that we're doing the right thing to create that safe and secure environment of care. So then they can deliver on our brand promise of excellent care to every person every day.
That's fantastic. And one of the things that crosses my mind, uh, you talked about the support that you got from the staff and everything. You had to have an incredible support base, though, from the folks in the C suites, from the CEO on down, because certainly this was not an inexpensive proposition. And I see so many times in the hospitals that we visit where the mindset is still, we don't need to make it more of an investment in security. Nothing's going to happen here. We know everybody. This is a small town, blah, blah, blah. The support that you got from your administrative staff had to be overwhelming.
It really was. And I won't say that they didn't give me my challenges to begin with. The orders I was given to create this department was to make it cost neutral. And so we do hear that a lot, obviously, in healthcare. And so the challenge I had was to go back to the drawing board, figure out a way where we could implement at least one or two police officers at each site on each shift at a time, and make it cost neutral. And so I had a nice spreadsheet that my finance manager put together for me. And I can tell you, I spent hours and hours at night playing with it and getting the numbers right. And we were able to do that at the onset to roll it out. And I think if I remember right, on the budget line, we were about 60,000 favorable to what we had been previously. But it took a lot of work and a lot of creativity around the staffing models.
I think everybody would agree cost neutral is a better option than cost prohibitive. So, uh, yeah, I just, I remember when you and I first talked when this started, when you were starting the program, and you were talking a little bit about training. And Tom, I'm going to kind of sway off here a minute. Talk about the training that the hospital police officer has to go through before he or she is considered a qualified hospital police officer.
So ironically, the same time I was proposing this legislation through the State House, the Indiana Law Enforcement Academy, and for those who don't know, Indiana is very unique in their law enforcement training. Every police officer in the state of Indiana, with very few exceptions, all attend the Indiana Law Enforcement Academy in Plainfield, Indiana, down on the west side of Indianapolis. And the state police have their own academy, but it's on the same grounds. And then there are a couple satellite locations that the law enforcement training board allows to hold their own academies. For example, here in Fort Wayne, we were allowed to have our own. But generally, everyone falls under that umbrella of the Indiana Law Enforcement Training Board. And they were just going through a process of revamping their training academies to a tiered academy structure. A tier one would be for your regular municipal county uh, officers across the state who would attend a 16-week academy. Tier two is going to be created for town marshals, the few law enforcement individuals that operate within the Department of Corrections, for the gaming police across Indiana. And the director of the academy at that time, Rusty Goodpaster, who was a very good friend of mine, he thought hospital policing would fit perfectly in that tier two level, which is an 8-week academy. So our officers have to attend an 8-week law enforcement academy where they're receiving over 300 hours of instruction on criminal law, traffic law, search and seizure, constitutional law, firearms instruction, defensive tactics, all the things you would get in tier one, but maybe not as extensive. For example, we don't have any jurisdiction on public roadways. So the traffic laws, while it's good to know them, we didn't have to have as much time spent learning the traffic laws.
So it's a 10-week training academy, 12-week. What are we looking at time wise of the investment your officers make?
Yeah, it's an 8-week academy.
8 weeks. Okay, excellent. Let's talk about outcomes for a little bit. I know you started this out with goals and objectives that you wanted to meet. What have you been able to recognize as a result of your efforts to provide a more safe and secure environment on all the campuses?
Well, first of all, from my old community policing days, which Fort Wayne was one of the leaders in community oriented policing, the first thing we wanted to really address was the fear of crime or the fear of violence. And uh, when our coworkers, our patients, our visitors feel safer, whether the numbers show it or not, their whole perception of the health system is going to be better. So we were able to address that first and foremost, fear of crime. And then what you have to do, and again, the same thing is true when you implement community policing, you've got to expect a rise in your crime or violence numbers because now that people feel that relationship with your officers, whether in a community or in the hospital, they're going to start reporting to you more frequently. So you're going to get more reports and see an increase. So it took us a couple of years to where I really felt we had kind of reached maybe a baseline for workplace violence and for crimes. And then leading up to the pandemic over the 3 or 4 years heading into 2020, we were seeing a decrease every year in workplace violence and crimes on our campuses. So uh, that was that was the direction we were really wanting to see things go. And then we would do surveys with our coworkers, and they would tell us the same things that they feel safer, they feel more secure when we have our officers on our campuses, and so we were really hitting all the measures we were looking to meet.
Thanks for that, Tom. You've heard me say this before. You and I have talked many times over dinner, over the phone, together, apart. How impressed I've been with what you guys have done. I mean, you're a trendsetter here. There's no doubt about it. You're an industry leader in this regard. Um, Certainly proud of the program. I hear in your voice, and rightfully so. And we're proud to call you guys clients and friends. How do you see the program moving forward, Tom? I mean, certainly knowing you as well as I do, you're not going to sit back and rest on your laurels. What lies down? What's down the road? What's next?
That's a really good question. Certainly today, we are finding ourselves in, I don't want to say uncharted waters, but the level of violence we're seeing across our country, not just in healthcare, um, has never been seen before. And we as a department, we've really bounced kind of back and forth with our identity. Um, we want those service minded individuals, and we're very committed and diligent to making sure we're hiring the right people who are here to serve others, and then be able to step into enforcement role that 1% of the time when they need to. I think one of the realities now is that that enforcement role is going to have to be a greater part of um, their job. That just the service industry piece isn't going to be enough anymore. That we're seeing violence on scales we've not seen before, and so I think it's continuing that training between having one foot in the service industry and having that other foot probably more than we would want to, but required to now in the enforcement piece. And so um, making sure we're providing the right training to our officers to operate in both worlds, making sure we're going out. I think we have to recruit more than we used to. It used to be that people just came to Parkview, and now I think we need to go out and really recruit more aggressively than we used to make sure we get the right people coming into our organization. I think probably helping other health systems and really health systems across the country understand what we're doing here and how, if it's done right, it can really be such a positive model for your organization. People are really demanding to be safe and secure because they're not feeling it very often. So I think those are a couple of the challenges that really face us right now. As far as what's next, we're really seriously looking at how to roll out the canine program, which is nothing new to healthcare. There are many hospitals around the country that have canine, but I think they provide a great opportunity when you have suspicious packages laying around or in the mental health wing as um, therapy animals that they're trained in that piece that can really help calm situations. And I think we'll see another drop in workplace violence when we roll that program forward. So those are a couple challenges and directions we want to go in the next couple of years.
Well, I guess free time is off the table for you in the next couple of years. It sounds like you're going to have plenty to do. Tom, I really want to thank you for joining us today. Your insight and your vision in where hospital security is going is just incredible. And again, having known your program as intimately as we do for so many years now, to see what you've done in building it is just, it's something we're proud to be a part of, and we appreciate that so much. And I hope that the listeners today have gathered some ideas. I know we're going to get questions about it, and I'll certainly run those through you as they come in. Thank you so much, Tom, for sharing some of your time with me. I know you're a busy guy and need to get back to work, and we're just about out of time here. So, friends, again, thanks for joining us. We've got many more podcasts coming up, and we hope you're enjoying them as much as we are, and that they are of benefit and value to you. This is Steve Wilder saying thanks, stay safe, and stay in touch.